and this is a partnership between the City College of New York and the City University of New York School of Medicine.
Hi, my name is Sophie English. My pronouns are she, her, hers. I am the psychological counselor, confidential advocate, and I work in the Office of Diversity and Compliance at City College. And our partnership, as you stated, is between the City College of New York and CUNY School of Medicine with my colleagues, Dr. Victoria Frye, who is a professor and researcher at the medical school, and Jasmin Salcedo, who runs our Gender Resources Program in Health and Wellness. And our project is Commuter Campus Students 2, a researcher-practitioner partnership to prevent and respond to sexual violence on an urban commuter campus in New York City. So the next slide. So our research goals, our first goal is to characterize ideal modes, content, and times of communication with students of information on existing services and prevention resources on and off campus, so really understanding how to best effectively communicate this information on a commuter campus. And then our second goal is to identify factors important to the adaptation of existing evidence-informed bystander-focused sexual violence prevention programs for diverse commuter students. We found that that is a need and something that we saw lacking, that these programs weren't really necessarily built for a diverse commuter student body, so we wanted to better understand how to adapt that. Our cross-learning goals, we have on campus a gender-based violence response and prevention task force that brings together constituents, and we all were part of this task force, so we want to increase the evaluation capacity of this task force, just also to inform like what research we need to continue doing and strengthen the collaboration between all of us on campus and also I think the campus as a whole, the divisions and departments on our campus. So I'm going to turn it over to my colleague is going to speak on the next slide.
Hi everyone, can you hear me?
Yes.
Great. So Jasmin Salcedo, thanks Sophie, Gender Resources Social Worker at City College. So our research methods consist of community mapping groups and in-depth interviews. So our community mapping groups, we're hoping for a goal of 6 groups to include 30 participants in total. And our groups, through group activities, will seek to characterize ideal modes, content, and times of communication with students on existing victim services and prevention resources on and off campus. And our hope is that the results will help us identify whether and how on and off campus spaces exist as potential sites of prevention behavior. And really important, we really want to be mindful of our diverse students and how sort of intersecting identities and systems play a role. So through hopefully 6 groups, we'll be able to sort of get some data. And secondly, in-depth interviews, we're hoping for a total of 30, and these interviews will hope to identify factors important to the adaptation of an existing themes in evidence-based sexual violence prevention programming, and hopefully also explore factors that influence the how, including past experiences, self-efficacy, ambivalence, responsibility, peer norms, outcomes and barriers, and effectiveness of bystander behavior, with a focus of, again, on the intersectional identities relating to intervention, content, and goals. So Dr. Frye will discuss a little bit about sort of the current status of the project.
Let me get back to the slides. I was just starting to send an email to Jasmin and Sophie. Okay, so what we've accomplished so far is it took us a while to get our IRB approval, but we did that, and we currently have planned out all of our mapping groups. We've conducted and piloted a mock group and are currently recruiting for those groups, and we are hoping to get those accomplished in May and June. Because we are an urban commuter campus, we have students on campus all year, which is great for us because it means that we are not too worried about, you know, enrolling students in the study before, you know, over the summer. We also have already begun conducting our in-depth interviews. We've conducted 4, and so we have a number to go yet, but we are noticing some interesting pieces of information emerging and information that builds on our previous research with urban commuter campus students. So we've actually already done one small in-depth interview study with commuter campus students here at City College, and that's actually going to come out in the Journal of Urban Health soon, so I'll send that around when that comes out. But what we're learning is a little, we're going into more depth, and we're really trying to understand both specifics about communication, but also really about prevention and how we would build a bystander intervention program that's tailored to urban commuter campus students. And so some of what we've been learning so far around communication are that there's a real diversity in terms of needs for communication, and that some students really need email communication, and others say they don't even open their campus-based emails. Uniformly so far, and some of this is echoing what we learned before, is that if professors are integrating it into their class and it is part of a requirement for enrollment in coursework, it's going to be done, and it's going to be prioritized. In terms of prevention, we are also learning that these commuter campus students have unique needs. The idea of prevention, though, is novel for a lot of students, and they do have a history as city residents of intervening in incidents, and they do understand a spectrum of violence incidents that they might intervene in. And while we were sort of anticipating that social identities and personal identities may play more of a role in whether they intervene or not, that's, again, it's early days, but it's not emerging quite yet. But we do see that personal relationships, again, based on a very small sample, are important to predicted intervention. So that's where we are in terms of the IDIs and the mapping groups. The mapping groups are really looking forward to, because of the the needs of commuter campus students related to on-campus versus off-campus. And in terms of cross-learning, we've been meeting weekly and developing our progress reports and feeding back everything we're learning to our task force. So I think that's it for me.